Diphenhydramine, also known as Benadryl. The mechanism of action of diphenhydramine is it blocks H1, which is a receptor for histamines. And it does this through blocking those histamine receptors both in the respiratory tract and the blood vessels and also in the GI smooth muscle. So when you think about people with anaphylaxis or allergic reactions, we often talk about how it speeds the process up, so people end up vomiting, they have diarrhea, they can be tachycardic, all of those things. We're trying to speed the toxin, the enemy, through the body. And so this is actually going to help with that because it blocks those receptors so the bad stuff isn't allowed to get into those tracts. And so we're blocking that, and we're going to reduce or alleviate the symptoms of the allergic or anaphylaxis reaction by doing so. It also works for dystonic reactions and extrapyramidal reactions as well. It's indicated for allergy relief, allergic reactions, and anaphylaxis, and do be sure that you know the difference between the two. Blood administration reactions are also quite common, so a person who's receiving a blood transfusion can also have some pruritus and feel uncomfortable, things of that nature, so it's a good medication to administer with that. It's also good for motion sickness and, like we said previously, acute dystonic reactions and extrapyramidal reactions. It's contraindicated if the patient's experienced hypersensitivity to it previously. The patient would have had to have it administered previously to know if they're hypersensitive to it. It's not a good idea for newborns or preemies, and you should use it with caution in infants, children, older adults, people with asthma, narrow angle glaucoma, and those who have taken MAOIs. Now, we do need to specify it says use with caution. It does not say do not give. You might want to consult medical control and discuss the administration with the patient themselves. Infants and children can sometimes have extrapyramidal reactions with it. It makes most people groggy. Children, sometimes it does not. Consult with the family for those patients, and then older adults, sometimes it can make them a little too groggy, or they can also have a reaction. So again, use with caution, but that does not mean do not administer. Some of the adverse reactions you see are drowsiness, which is the most common, sedation, and seizures. Interactions, it will potentiate someone who has significant amounts of ETOH in their system, so I would recommend caution in administering it to patients who are significantly under the influence of alcohol. The dosage, the adult dosage, is 25 to 50 milligrams IM, IV, or PO. 25 to 50 milligrams for an adult with a duration of somewhere between 3 and 12 hours and an onset of 15 to 30 minutes. For pediatric patients, we would dose at 1 to 2 milligrams per kilogram IV or IO. If you were to administer PO, you would do 5 milligrams per kilogram. So for pediatric patients, through IV and IO, we would do 1 to 2 milligrams per kilogram.